author of a book called Functional Medicine, The New Standard. I am Amita from Nourish Doc, a platform for evidence-based natural and holistic therapies. I'd like to introduce all of you to Dr. Kevin, who is joining us live from Texas right now. Welcome, Dr. Kevin.
Hello, how you doing, Amita? It's a pleasure to meet you, by the way.
Great. So let's get started on, how do we start the process of what you talk about in your book?
So, the title, I got a little slack from a few colleagues because they were saying, functional medicine, the new standard. And they're like, well, what's the old standard? I got a kick out of it because, at the beginning of my book, I tried to emphasize that we're not talking about a new medicine. We're not talking about new diseases. We're talking about the same diseases that I learned in traditional medicine, but flipping the switch and the template of how we view disease is really the new standard. And by starting at the last chapters of a book, which I call Death and Disease, and focusing our attention there rather than looking at this process as if a book in the earlier chapters and keep pushing our sense towards the earlier chapters that led us to those last chapters is the new standard of how to think about disease and health.
Okay, so what are the steps?
Go ahead, sorry.
No. I'm just a user. How do I get started? What are the steps that I need to take?
So, in my book, I really try to lay out, regardless of where someone starts in their disease process, they can, let me step back. When I'm working with a patient, it doesn't matter where they start, whether they actually have a disease or more likely having a lot of symptoms and signs where they're in that kind of chronic disease state. What I found myself doing over and over and over again is really addressing first what I call the basics. And the basics are those fundamental components that lead to everyone down the pathway towards disease. It doesn't matter the name of the disease. It doesn't matter if it's heart disease or cancer or stroke or diabetes or dementia. Ultimately, what got us down there was the same basics. And so the foundation of the book is really talking about, in essence, what is the trigger that led towards the disease pathway. So an analogy that I use is that imagine you're walking up to a beautiful river and you're by yourself and you see a sign and it says, or there's actually a nice little raft and it's a beautiful stream and it's just gorgeous and serene out. Yet right next to the raft, there's this danger sign with skull bones. And it says, danger, if you get on this raft, at the end of the stream, there is a waterfall and you will die. Yet you're drawn towards it. It's so beautiful. You're like, it's such a slow rolling stream. I could get off at some point, whatever. So you get on this raft, you go around the first bend, and it's even more beautiful than what you imagined. And the stream is just chilling along and it's beautiful out and it's several hours into it. And you're like, gosh, I'm so glad I got onto this raft. And before you know it, you're going around another bend. And you notice that the current is a little bit stronger, but you're human. And you're like, hey, it's gorgeous out. It's a beautiful day. I'm by myself. I'm going to enjoy this. I'll jump off when I get a chance. So you go around another stream. This time, oops, there's the waterfall in the distance that you see. And now the current is really strong. And trying to pull yourself to the side is now a lot more challenging. And this is that strong current that's pulling you towards that waterfall. The waterfall, by the way, is the disease. And I want you to imagine just on the side of this mountain or the waterfall, there's a guy there and he's yelling at you and you can't hear him very well because all the sound of the roaring of the water but it's me. And it's
Mm-hmm.
telling you, why did you get on the raft in the first place? Didn't you see the sign? Okay. And I'm throwing you now ropes and, you know, all sorts of things to prevent you from falling over. That's me in the traditional world. I'm trying to do everything I can to just kind of stave off the inevitable. But really, as a functional physician, I'm standing by that raft initially, telling you why you shouldn't get on there in the first place and how you got on the raft in the first place and what led you down that. And that's life, by the way. You know, that stream where, you know, eating that bad food, drinking the alcohol, doing the bad choices of lifestyle choices that we talk in our minds, that we could talk ourselves into, is that stream. And until we kind of have that realization of the waterfall, kind of like what we're all experiencing right now with the pandemic, for example, we don't really have it in the forefront of our minds. And the tools that I give in my book is to help everyone understand the basics that lead us down that path and onto that enticing little raft in the beginning. And so the trigger, or what gets us on that raft, is what I call the 5 stamp triggers. STAMP. Stressors, toxins, allergens, microbes like bugs, and poor diet. And I go through each one of these chapter by chapter, helping identify what each one looks like. Now, another analogy that I use is that I like to look at each person as if they're like a business. Okay, so you are the CEO of you, Amita, okay? And you're coming to me and you say, gosh, you know, I feel like my business, I feel like I'm working really hard. I feel like my business is doing well, but gosh, I feel like it should be more profitable. Hey, Kevin, can you come in and kind of take a look at this and see what I may not be seeing? Well, if I was a consultant, I would be looking at it from 3 different kind of basic areas. First, I would go to all your managers that work for you, and I would listen to them and sit down and let them basically essentially bitch to me about everything they don't like about their boss and why they're not listening, okay? And then I would go to their subordinates and I'd listen to them, and they would complain about their boss. And I'd get a good feature of what the sense of the business is, or what I call how you feel, okay? Yeah. And so how your body is telling you how you feel is kind of like the business or the managers displaying directly what's going on. But that doesn't tell us the whole thing, okay? Part 2 is in the off hours, I'd probably walk around your business and I would kind of see what it looks like. Does it look beautiful? Is it enticing? Is it clean? Is this a place a business that I'd want to go to? When I walk in, is this a place that is enticing for the employees to work? Can they efficiently do their job? And this is the second piece, body composition. So I do in 21st century medicine, I'm not a fan of scales. In BMI, these are absolutely lousy markers for body composition. I do a DEXA body composition scan, and this is a scan that takes 6 minutes. I do in my office. Frankly, I think every practice should have these. And to the gram, it tells you your fat to muscle and gives me a very good idea of how your body structure is. And, you know, we were talking before this live component that your past life, you were an architect. And so you appreciate how structure and function make a difference. And so that's part 2. Part 3 is, okay, let's say I come to you, Amita, and I say, look, your people that work for you, they love you, okay? Second, your business looks great, beautiful, totally designed well. And then you're like, well, then why am I not profitable? And I go, well, I looked at your Yelp reviews and your customers hate you. You don't listen to them, okay? And this is the third piece. This is the biomarkers or your labs, okay? And so in order to assess if someone is healthy within stress, toxins, allergens, microbes, or poor diet, I look at all 3 of those values. If they align, that piece is healthy. So for example, let's take diet or poor diet in under the P. Under poor diet, let's say we go to, first of all, foods. So if you, and this is why I always like to remind people, I don't care if you're a vegan or a carnivore. It really doesn't matter to me. More importantly is I want to know how your body is speaking to you. Now, for me, for example, when I eat beans or legumes, for example, I feel awful. I feel bloated. I feel gassy. My bowels aren't good. So being a vegan with a bunch of beans would be a horrible dietary choice for me. Where there are other people, they feel great on it. And so the first piece is, how do you feel after you eat? Within an hour or two, do you feel energized or do you feel tired? Do you feel bloated and gassy, or do you feel fine and your GI system is not really working that hard? So, but we all know that people can eat like crap and feel fine. And so that's only why it's only one piece to the overall healthy. The second piece is your body composition. How is the fat and muscle responding? Is your fat going up and your muscle going down? Probably not a good dietary design for you. So again, for example, I have lots of people I call skinny fat. Okay, so in clothes they look fine, and the general person would say, hey, you look fine, and on their BMI would say they're within normal limits. But matter of fact, a majority of their fat is in their android distribution. Okay, so in their lower belly, that's actually dangerous fat. That's actually inflammatory distribution in the liver. And so that is actually a very, very poor structure. So that's part two. And then part three would be, okay, let's say you feel good and your DEXA composition is pretty solid. Then the third piece is, what do the Yelp reviews say? What are the biomarkers speaking to? And so this is, in that chapter, I talk about insulin and fasting blood sugar and hemoglobin A1c. And I look at these markers and I assess what the Yelp reviews are saying. I think there's a, sorry, I know you have some of these scanned in here. Why don't we move over to, real quickly, the poor diet section.
Okay, which one is?
Keep going. Sorry, we can always go through some of these later, but.
Sure, absolutely.
Keep going, one more. Right there, poor diet. There we go. So I kind of talked about, go to the next one for me there. Go one more. Okay, so on the top there, it says biomarkers. So
yeah,
there's the fasting insulin. So this is an important one, for example. When you're looking at the word stamp, S-T-A-M-P, there was a reason for my design. The S and the P are the pillars. And just like in architecture, if you don't have strong pillars, your foundation is rocky. And so S, stress, okay, is the hormone cortisol, where P, poor diet, is the hormone insulin. And I always like to remind people, when you're starting, I don't care where you're starting from in terms of how you feel. And until you heal the cortisol and until you heal the insulin, you will heal nothing. Okay, it literally, everything else is a Band-Aid. And so insulin, almost always a problem in my starting patients. What's healed is an fasting insulin less than 5 that I make a mention in my book. But I also bring up what's called hemoglobin A1c. This is what your average sugars have looked over the prior 12 weeks. Now, sadly, in traditional world, and I was trained in it, I went to med school, I did all, I worked in this world for 15 years. What they will consider normal is 5.7 or lower. 5.7 is basically a blood sugar of around 110. And diabetic levels by traditional numbers is 126. Do you think your body knows the difference between 126 and 110? No, okay, it's just too high, and it leads to glycation, which is the sticking of the sugars to the proteins in your vessel walls, leading to eventually oxidative damage. So the point being is that with functional medicine, we don't treat the labs. We set the parameters of what optimal is. And optimal is a hemoglobin of less than 5%. Very few people start with me under 5%, but after they get done with me, they're at 5% or lower, okay? Because then they learn and appreciate the foods that are raising their sugars and leading to literally any and every disease in the US today. You can literally say heart disease, cancer, strokes, diabetes, the top 4 causes of death in 80% of us is due to high blood sugars. And that's the getting onto the raft piece. Okay, it's the kind of one of the first steps that rolls us down that river. The next piece to determining if poor diet is healthy or not is looking at the HDL to triglyceride ratio. Again, this tells me a very good idea about your diet. If HDL to triglycerides is a 1-to-1 ratio, I can be pretty reassured that you're not bringing an excess amount of carbohydrates, for example. Triglycerides is simply a way of kind of determining if we have transporters that are in excess for our carbohydrate intake. So if we have excess carbohydrate intake, we get a triglyceride and it's just going to transport it. And generally speaking, it's going to dump it in the liver, which is in the android distribution. So that's the belly fat, okay? And the #1 cause of liver failure in the United States today is fatty liver. So it's no longer alcohol, it's no longer Hep C, it's actually our diets. And then the final of the biomarkers to help patients assess if their diet is healthy or not is their fasting blood sugar. Again, fasting blood sugar of 85 or less is the mark that I challenge all my patients to get to. Again, it's sad, but if you look at labs, they'll say anything under 110 is normal, okay? We would not allow this in babies. We would not allow this in teenagers. Why we're allowing this in adults, I don't know, okay? But the point is we need to set, first of all, our parameters at what is considered optimal. And what is optimal is how our body functions the best. And so in that parameter of the chapter of poor diet, we've just kind of gone through what healthy looks like. How you feel, your body composition, and the biomarkers.
Got it.
And now you don't have to read that chapter.
Okay. So all right. So what do we talk about after the diet part? Do you want
so going back, I mean, I can't obviously talk about the entire book in
of course not
minutes, but because there's a lot of meat there, but the big picture is that these 5 triggers, these stamp triggers, if you were to go back in the book of the chapter, the chapters, and I like to think of people as kind of like books. And in the earlier chapter of what causes us to go down that stamp, to choose those stamps, is the decision we were making to look at that raft and see how enticing it was and ignore the skull bone warning, okay? And this is our thoughts, okay? And let's be honest here, it's like when it comes to health, a lot of times it comes down to lifestyle choices. I deal with this every single day. We are amazing creatures at convincing ourselves why we should get on that raft and ignore the skull bones. And I do it all the time. We all do it. But sometimes we do it unconsciously. And frankly, we just kind of are almost kind of not even seeing the sign. And so that's another way that I see the basics is what are the basic skull bones signs that we're all kind of missing in this American diet, for example. That can get very complicated, but I think we've complicated it way too much. We don't need to get caught up in the weeds when it comes to dietary or the kitchen, I like to call it. we need to get back to the basics first. And once you understand the basics, then getting into the weeds makes sense. But too often when people talk about diets, which I personally don't even care about the name of a diet, that's the weeds. But people are not understanding that, okay, wait a minute, there's earlier chapters in this, and there are more important elements that needs to be addressed first.
See, the other thing what I feel is in America, that the fad diet or your fast food diet, as you want to call it, is cheaper, more affordable, economical than an organic food. So if you, I mean, majority of Americans maybe cannot go and shop all the time in Whole Foods because it is relatively more expensive than going to a fast food restaurant.
Let me just stop you right there. Whole Foods is whole paycheck. I get it. I'm not a fan of necessarily going to Whole Foods, for example. I think you could go to your regular grocery store and choose just really good foods. Doesn't have to be of highest quality to start. It doesn't have to be expensive either. Frankly, though, to be honest with you, I think most of us are lazy in the kitchen. Part of it, and I would totally put myself in that care. I don't like to cook personally, actually. When you go to McDonald's, like my 11-year-old daughter, one time she forced me, in a sense, to go to McDonald's. She's like, Dad, you've never taken me to McDonald's ever in my life. And every kid's gone. And, my wife's like, oh, we should give her one experience. I'm like, why? And so I did it. I was like totally against it. We went in the drive-thru, and I was shocked. I mean, there was 2 drive-thrus to speed it up. And the price was like $3.50 for like quite a bit of food for this one little child. And you're right. We had the food in like 4 minutes. It was incredibly efficient. So I was like, no wonder people do this. Absolutely. But, honestly, this is where I kind of try to look at from the practical standpoint is, okay, if you are someone who eats at McDonald's, for example, or sees that as, okay, that's my best option, then there are ways to eat better. Okay. You're not going to eat the best, but how can you maybe make it better? Well, instead of eating the bun, you maybe do a double burger and maybe do one of their plant-based burgers that they now have. Maybe instead of choosing the vanilla chocolate shake, you just get a water. There are little things you can do to enhance wherever anybody's at. I honestly believe that pretty much every place you can learn how to order a little bit better. And once you start to order better, here's where the transformation of Amita comes in. And I hear this all the time. People say to me after I kind of change their diet after 2 weeks, and then they go back to their old habits, and they try it once, and they come back and they're like angry at me, and they say, gosh, I feel like total lousy garbage now that when I eat this garbage. And I'm like, they're like, thanks a lot, Kevin. Thanks a lot for making the food I used to eat not palatable anymore. And I'm like, I didn't do anything. Your body just now is on new alert. Your receptors telling you what's bad and good is now on again. Before, you were just eating crap, and you stopped it for a little bit. The receptors reset. The light on the car started to flash again because it said, okay, I guess he's going to listen to me again. And they turn back on, and then you eat the food and you're like, wow, I really feel lousy eating this food. And instantly people will start to eat better. So I always encourage people, try for 2 weeks. Try to just eat a bunch of vegetables and a good protein source just for 2 weeks. You cut out alcohol, cut out, look through my poor diet chapter, follow it precisely, and just do it for 2 weeks. And I absolutely 100% know you will feel absolutely lousy the next time you eat crappy food. And that will be in itself your warning sign turned back on, signaling to you, hey, you may not want to get on that raft because right here is the skull bones.
No, I agree with you. I cannot, I haven't gone to McDonald's. I don't even remember when was the last time I went to
Good.
Not that I'm trying to beat McDonald's, but that's just me.
Yeah,
But,
no.
you know,
And you know what, you're bringing up a really good point with, you know, there's lots of people, you know, you brought up Dr. Mark Hyman, for example. He was one of my teachers, and he has actually looked into this and in the costs of comparing organic foods with you know, fast foods, and it's really not as expensive as people want to make it out to be. I think, again, that's kind of an excuse. Look, if we were to just reduce our Starbucks a little bit, or our cigarettes, or our alcohol, or, you know, look, those extra snacks that you're spending, and use that money towards a little healthier foods, I think most people could afford, on some level, a healthier diet. I don't think we should be making excuses. Now, if you're living in a third world country, I get it, okay? But we're, you know, in the United States, our poverty level is not anywhere near the levels. I've lived in third world countries. We're not even in the same ballpark. And we have Medicaid, we have services, because I've worked those services, by the way. I worked in Medicaid offices for 10 years. I'm not talking from someone who hasn't worked with people with a very low socioeconomic backgrounds, and there is support. There is capability there. So I just don't see that as a good excuse. I really don't.
I think it's the education, and that's why we have someone like yourself, you know, really educating the end users. When we put this video up to, you know, coming from a doctor, people would pay more attention when the doctor is talking, hey, my MD told me to do this, is very, very important to really advocate better nutrition, better diet, because I think a lot of people still in this country maybe are not aware of all the issues that come with having a SAD diet, right? Standard American diet.
Right. Yes. And, you know, you bring up a really good point. You know, what's sad is when I went to medical school, nutrition was a 2-week course. And it was considered a blow-off course. It was like the easy course. Everybody was excited about it because it was like, oh, finally we have one course that we don't have to think that hard. And it was a kind of a break. And I remember it just being kind of, you know, gosh, I don't even remember I learning that much. Everything I've learned about nutrition, frankly, has come in the last 10 years of my career. First 10 years of my career, I put very little focus on it. I would tell people, eat better. What the heck does that mean? You know, and
it's a definition.
Yeah, and you know, as a traditional doc, I didn't have the tools to even really educate very well in that area, and frankly, I kind of avoided it a little bit because I really didn't have the knowledge, the appreciation, the understanding, the comfort level to discuss it. And if I were to guess, most of my traditional colleagues probably still feel that way, unless they have really jumped into it on their own. And I know many docs these days are, which is great, because you start to, when you're in this world of traditional medicine and you see the health issues over and over again, you start to appreciate it really does come back to the basics of first in the kitchen. And if you can transform just that one piece, it makes a world of difference.
So that's amazing. So if we can talk for a few minutes, just what made you decide to go into functional medicine?
I moved to Austin.
Okay.
And I was practicing out of California for a little over 10 years. We got pregnant, and I delivered my own daughter.
Very nice.
So where in my family, as a family doc, I did everything in my town. Literally, I was the town doc, and I was exhausted. And my wife and I decided to move out of a mountain town. We were in Lake Tahoe at the time, which is gorgeous, loved it, but it just wasn't as conducive for a baby. And so we did a national search, and we ended up in Austin. Being here in Austin, I call this kind of the California of Texas. I was kind of surprised because I had some colleagues who said to me, gosh, you practice a lot like a functional medicine doc. And I'm like, what the hell is functional medicine? I was kind of offended at first, to be honest. I was like, what is that? And they said, oh, you got to just look at it. You just got to take a look at it and, go to the conference. I think that's when I learned about Dr. Mark Hyman.
Okay.
So I went to a conference, and I was instantly hooked. I was like, oh my gosh, there are other people on this planet who think like I do, and think that, there is some massive holes in our traditional design. I'm not against traditional medicine. I think it's fantastic. If you are in the 5% group who is who is massively ill, like my father was at one point, where he needed a kidney transplant, traditional medicine is fantastic. We do an amazing job in this country. Unfortunately, we're only covering a small population of people that really need us. And 95% of us fall into that chronic condition. And I didn't see our tools really helping that. And I just got burnt out with just writing scripts and just kind of band-aiding everything. And I just kept asking myself, every time I asked the question, well, why do we do this? But why do we do this? No one gave me a good answer. And so I went on a 2-year sabbatical from my work, and I just worked side jobs. And I just studied, traveled all over the country. I literally went to 6 different kinds of teaching. I said to myself, okay, I'm not going to think just traditional anymore. I'm going to just open my brain and be open to the possibilities. And honestly, that was the first starting point for me, is I was just open to hearing new ideas. And I always try to remind my patients, if you start to open yourself up to, hey, I'm not feeling well, I haven't found the answers. First of all, open your brain and thoughts up to saying, okay, I'm willing to try something different, even if it sounds weird, hocus pocusy right now. Let me just try it. And that's when kind of my template kind of flipped on itself. And that's when I got into functional medicine. And I don't think functional medicine has all the answers either. But what I do think it has is why I call it the new standard, is it's really should be the old standard, is looking at disease from the earlier parts of the book rather than at the last chapters.
Sure. And then you wrote the book like a few years back, right? When
no, actually, no. So the book just came out in May.
Okay.
I spent 2.5 years writing this book. I wrote it 4 different times because I wanted it to be right. I literally tossed the first 3. My wife's like, "What are you doing?" But I wanted it to be perfect in the best I knew how. Where it would be a really easy stepping stone for anyone to just read, pick up. The idea of my book was you could, go on a New York flight to California, have read it by the time you get off that flight, and take home some major back pocket messages that you could institute right away into your life. That's really what was the design of the book.
Okay, well, that's great. That's great. And book is available on Amazon, and I'm assuming, right? It's
on Amazon in both Kindle, paperback, and I even do my own audio. I don't like when authors don't do their own audios, so I read it myself as well. So if you prefer that route.
Okay. That's great. So what we'll do is, of all the viewers, when we post this video, there's a book, Dr. Kevin's book is out there. It's called What is Functional Medicine, right?
It's actually Functional Medicine, the New Standard.
The New Standard. So that's the book that you want to take a look at it. And, we post the videos. If you have any questions, you're welcome to, email us or talk to us or put any comments. We are open to all the questions you have for Dr. Kevin, and he'll be happy to get back to you. Anything else you'd like to add before we wrap up this session, Dr. Kevin?
No, I just really appreciate this forum, Amita. I love your heart. I know that your starting point and your story you were telling me earlier was you just weren't getting the questions answered for your own health.
Yes.
And frankly, I think that's, the story for a lot of us physicians who moved into functional world and integrative world is we weren't getting the answers of the why. I just want you to know that there are physicians out there. We hear people like you who are suffering. I get really frustrated when I can't tell a patient why. And if they're suffering, I suffer. And it's great to hear that you figured out your formula. But if you kind of go to the book, this is kind of the formula that's worked for majority of my patients. That starting piece is the key. We don't need to make this so complicated. That's something that I've learned over 20 years. The science is really challenging and complex, but the treatment is pretty straightforward.
The other thing is like when I had the issues like about 10, 15 years back, nobody knew the word functional medicine,
Oh, absolutely not. Yeah.
There was just like, you go to the doctor, and if the doctor cannot figure out what's wrong with you, then you don't know what's wrong with you. So you have no hope, actually, quite honestly. So nobody understood what functional medicine is. You just still keep doing what you're doing. And that's now, thanks with so many MDs going into the functional medicine, I think it's such a blessing for all people like us, all of the users, that MDs understand that, what the importance of diet, and they're advocating the importance of diet and meditation, as you were saying earlier, as well, the mind and the body together. And that's what makes all the difference now.
Yeah, and I like to always give a lot of credit to Dr. Jeffrey Bland. He's the doc who started functional medicine. He's considered the father of functional medicine. And he asked the question back in 88 and 89 with a team of docs and professionals of, why? He spent 2 years building that platform of what now we consider functional medicine. And any physician, I don't care if you're a family doc or a neurologist or ophthalmologist, every one of these docs can get trained in functional medicine and be a functional ophthalmologist, a functional neurologist, a functional nephrologist. It's a way of thinking. It's not a new medicine. It's just looking at disease from a flip. And as a traditional doc, it was a wow moment. That first year when I was learning it, I honestly felt like I learned nothing in medical school. I just had that moment, like, I was like, did I just miss everything? And why am I feeling like I have to relearn everything again? But that was exciting. It was a breakthrough in my own experience. And yet I had all this clinical experience by that point, but it was still like an aha moment. And I want that to be for everybody. I get excited about it. And that's why I wrote the book too.
That's excellent. Excellent. Well, thank you so much for joining us today for our session, and we'd love to have you back. Apologies, we couldn't do the FB Live. For some reason, FB Live wasn't working, but we put up this recording in tomorrow and within this week, so for our viewers to watch your recording. So thank you so much for coming.
Oh, you're welcome.
Yeah,
it was so nice to meet you. Thank you for having me.
Yes. So with that, I'd like to end this session. To our viewers, thank you so much for watching us, and thank you to Dr. Kevin. Have a good afternoon.
You too.
Bye-bye.